Well, welcome to the show, Recovery Centers of America. It's a healthcare network of treatment facilities for substance use disorders and co-occurring mental health conditions. They're involved in the East Coast and the Midwest, and they're now in Greenville with their newest treatment facility right here in the heart of Greenville. We've got Dylan with us, Dylan Metz, Business Development Manager, and Chris Rubio, Alumni Coordinator. Guys, welcome. How are you?
Good. How about yourself?
Good to
I'm
see
glad
you
you
guys.
brought the love pillows.
That's right.
He's got the love pillow.
It's all love here.
Yeah, the Recovery Centers of America, you guys are all about sharing love, getting people back to where they're enjoying their lives. So let's talk about, people are talking about mental health more often than not. They're talking about, substance abuse. Talk about some of the things that you guys, deal with at your centers.
Exactly. So we're really excited to be bringing what we've brought here and what we plan on bringing as well too. We've been able to open up with a full inpatient detox and residential facility for substance use disorder. A 7-day detox and anywhere between a 20 to 30-day residential program that really is fostered in an environment that promotes, comfortability, safety, security, and harbors a therapeutic environment for individuals that are looking for that, that need that. And just being able to bring that advocacy and that awareness as well too. And as far as the medical staff goes and the clinical, all those components coming together.
Are there any age brackets? What age children are involved? It's men and women, grown men and women,
So
teens?
yeah, we don't have any adolescent programs at the moment, but it's all 18 and up, male and female adults.
What would you say to folks to identify when there's a time to reach out for some type of help? Because, people go through all these things like dry January, things like that, mental health issues in and out. When is the time where you say, I really need to reach out to these folks and seek some type of treatment?
And that can look different for everyone, obviously in the professional sense when it's affecting your job or when it's affecting, family relationships or marriages and things to that degree. And then you've got the physical component as well too. When you're bringing on, kind of different detox symptoms and the anxiety and the depression and the mental health ailments that come with that as well too.
Well, Chris, is a referral needed, like a regular doctor?
No, referral's not needed. We actually have a 1-800 number, 1-800-RECOVERY that anybody is open to call.
All right, well, there's your 1-844 number, but there is a 1-800 number. Can we go to your website and find that?
Yes, yes, it's on the recovery. Actually, if you come across our center and you see our sign off the freeway, it is actually 1-800-RECOVERY.
Okay.
It's on our sign, so anybody can reach out for support. You don't have to be from the Greenville area. Anybody anywhere can reach out. And if you are from this area, if you're from another area, maybe up north, maybe one of our centers. We have 11 centers across the East Coast, up north. We're the most southern, but we'll find a place for you.
The benefits of this is getting that professional help that people may not know that they need. And once you want to go to a place that can take care of like the whole person. And I love the fact that you guys also have an alumni program too, because it starts when they come to the center, but that's a lifelong a thing that you have to deal with. And so you want to make sure you still have that network of community to say, I'm kind of struggling again. Talk about the alumni program that you guys
Yeah, so
do.
I'm fortunate to be the alumni coordinator for our Greenville campus. And what that truly is RCA has the continuum of care. You come in, maybe for a detox, you step down to a residential, you step down to maybe a PHP program, a partial hospitalization program, step down into an IOP, an intensive outpatient program, and the alumni is able to walk with the individual through that whole continuum.
Yeah.
So I facilitate groups. I have groups during the week. I really foster a relationship with our patients, and as they leave treatment, we have a connection as well. So RCA has a robust recovery community. They have 130 online meetings that's open to anybody, not just alumni. Anybody can join that's seeking recovery.
And that definitely separates you from some of the other folks out there, that having that continuum of care, which is such an important
Yeah, and
thing.
so when you say group, you mean group therapy sessions?
Not necessarily group therapy, but more of recovery meetings.
Okay.
So the opposite of addiction is connection. So we really encourage our folks that once they come into recovery, that they get connected.
Okay, RCA.
There you go, 1-844-5-RCA, and we'll be sure to put all that information for you at our website, yourcarolina.tv. And like they said, you can always call 1-800-RECOVERY. We appreciate it, guys. Thank you so much for coming on and talking about this.
Thank you, gentlemen. We
Yeah.
appreciate you guys.
Of course.